You found the water already? Excellent. Hi, everybody. Thank you so much for being here. I'm really excited to talk to this group. You've all been have very extensive experience sort of putting science and engineering into practice around this issue. And I'm really excited for everyone to hear about what you've seen and are seeing and are building. So I think I want to start in the end with Nikki. As part of your, I'm sure, many tasks, you are meant to create a report for Congress about the lessons learned in COVID-19. Can you give us a sneak peek of what might be in there?
Hi. First, I should tell you a little bit about the brand new office, because it started in August, so we're brand new. I am the Deputy Director and Chief of Staff of a new office in the White House called the Office of Pandemic Preparedness and Response Policy. We are our own component, and we were created by Congress. And I would say we are the lesson learned from the past. We were created because in the past, the White House has always had a coordinating structure team that came in to coordinate any kind of outbreak or response. And now this office is permanent and will always be at the White House no matter what and who the administration is. So that we can continue to do preparedness efforts and coordinate federal responses, both in peacetime and during actual responses. So as Alison mentioned, we are doing a report to Congress as mandated. It'll be coming out in the end of 2024. Important to highlight, this report is not just what the federal government thinks about itself. We could do that, but I don't know how useful that would be, to be honest. This report is going to include after-action reports from all of our stakeholders, partners, anybody who wants to contribute to it, and also, of course, the agencies in the federal government. The report will also highlight the wins that we had during COVID, the incredible programs like Cindy's program, and also those programs that perhaps are going to go away because there's no longer funding for them. It'll also capture the gaps that we identified during COVID, like the data sharing challenges that we'll talk about here today. And it'll, more importantly, give recommendations for how to fund things in the future in the federal government. So I can tell you now.
Wilma, can you give us your perspective about what you've seen working with the Africa CDC and across the continent?
Well, let me start off by saying that I do most of my work on biosecurity governance, basically looking after how one creates a community of people who take responsibility, safe custodians for looking after issues of biosecurity. I do most of my work in Africa. I'm a former member of parliament from South Africa, so I go home often. And 4 years ago, I would go home and speak to ministers in government and raise the question about biosecurity issues, and they would say, well, that's a Western issue. That's not our issue. This is the West worrying about security globally. They don't say that anymore. Okay? COVID-19 has actually illustrated what the risk is. We built on the African continent over 40 laboratories. Some biosafety level 3, biosafety level 2, and there are a few additional biosafety level 4 labs being constructed. And we did it quickly because we had a public health emergency. And so certain things had to be retrofitted to make sure that those labs are safe and secure. So to say that on the African continent, people have recognized that this is a big issue, and the community that's recognized this is the national security community. That's where the signal is coming from. And let me tell you, when the national security community takes notice, there is greater political will, greater energy, more budgets available to take care of this issue. So it's a massive opportunity. So let me just say that after 4 years of talking to my colleagues in various governments, the penny has dropped. There's a window to do something about this. The window is actually quite small. And so now we have to go about the business of building platforms to make sure that digital information that can cause harm, like now powered by synthetic biology and artificial intelligence when it comes to diagnostics, surveillance systems, and vaccine R&D and manufacturing has to be kept in safe hands, in a safe pair of hands. And that requires government action, and it also requires public education so that people understand why it is that the science community is focused on this, what the public purpose is. And so to say that that's the lessons that come out of this experience, and so we have lots of work to do. And so glad to speak to you today about what that work actually is.
We're going to come back to several of those points, hopefully. Thank you. Cindy, Nikki just flagged your program as a highlight of something that worked. Can you talk a little bit about the wastewater surveillance program, where it stands, what you've learned after 4 years?
So thank you, and it's great to be here. And I think before I talk about the wastewater surveillance program, I just want to level set and make sure that everybody knows why travelers are so important for sentinel surveillance. And we figured this out pretty quickly in the pandemic, and I think everybody sees that travelers get and spread infectious diseases all over the globe really quickly. If nothing else, it was evident in COVID. And so they can act as sentinels as a valuable tool for early detection, and I think Matt talked about that half of the equation. We might argue about different public health strategies or mitigation strategies or what should be done, but I think we can all agree that buying critical time with early detection is good for everyone, and I think no one would disagree with that. And so for a long time, we looked at travelers health clinics. When they came back, we were able to detect SARS-1 early in a travel clinic. We were able to find malaria in the Caribbean where we didn't think it existed before. But it takes time. We have to make sure that the traveler goes to a clinic, that they get to see a doctor who orders the right test, who then sends it to the lab, and then we need genomic sequencing, and that takes more time. And with the COVID pandemic, we were always behind and out of time, and we didn't have the luxury of time. So we set up this program, and I think the key to the program was really the public-private partnership between CDC and our two partners, which is Ginkgo Bioworks and XpressCheck. And there was a need for the industry side, like XpressCheck was a spa company in an airport who was looking to do testing of travelers. Ginkgo was doing K through 12 genomic testing and could do a really fast throughput of sequencing data. And we in public health were getting information late. So we set up this program where we could test travelers. And we didn't even know if it would work because we asked travelers to volunteer and give us a nasal swab, sort of on their way running for a cab in the airport. And we could get that swab. It was anonymous and voluntary, get it to the lab, get it sequenced, all within 10 days, and get that information out into the public domain to detect new variants. And we were able to do it. We get about 9,000 people volunteering a week to do that. And we've enrolled 500,000 travelers since 2021. But
go ahead.
Sorry, go ahead.
I was just going to say, but now there's these sort of contracts are drying up for these programs. So I'm curious, like, how are you now starting to think about wastewater surveillance at the CDC?
Right. And we also showed that wastewater surveillance is another modality, so you don't even have to engage the traveler. It doesn't disrupt the transportation, the ground handlers or the travel sector, and you can get that information and you can use it as a proxy for what's going on in the community for early detection. But you're right, we're at a point where funding, it's an interpandemic period, and there's this cycle of complacency and crisis that we live through over and over again, and I can't explain why. But I think collaboration and with global partners, there are some models showing that if we do airplane wastewater surveillance, the group at Northeastern that Matt mentioned, Alex Vespignani's lab, has shown that we can buy 3 months of early detection capability if we have about 10 to 20 nodes of countries that collaborate with wastewater surveillance. So we can go from a cycle of crisis and complacency, or complacency and crisis, to collaboration and stability if we work together and combine resources.
Can I ask, and Matt mentioned it, and I think I hear about it a lot, data and information sharing being sort of a key, a linchpin in all of this. How do you think about, like, what is the mechanism right now? You each represent very different parts of this process. What is the mechanism right now for, like, putting, the right data in front of the right decision makers with the right amount of time so they can make the decision? How do you think about that? Nikki, maybe do you want to?
So for us, our goal, we are a coordinating entity across the entire federal government. So it is very important for all of the different programs that share data, including the VA and DoD, every program within the federal government to be sharing the data themselves. It is something that we are working on to make sure that everybody's coordinated, but it was a gap that was identified during COVID, so it's something we're working on hard to try and get those agreements. But then on top of that, it's important to get data sharing agreements from every single jurisdiction, which is something CDC is working very hard to accomplish. But as the coordinating entity, we just are trying to have all the different data sets. Imagine if we could actually have the data from all of the different areas that the DoD is in the entire United States and the world. That would be a great data set. So we're trying to think a little bit outside the box to try and coordinate everything within the federal government.
And then how do you think about the handoff to something like the African CDC, right? I mean, going even further beyond, what are some of the concerns about how data is distributed, shared, accessed?
I mean, it's really important when you're fighting a pandemic that you have a common set of norms in terms of which data you collect. And as you know, data is collected on a national basis. And so the kind of fancy word is an interoperable data collection system has to be built, so that when you share data, you're sharing the same data, not different data about this or that. So you need some norms to guide that. So what's required is, in fact, define those norms, define the systems, get the categories down as globally applicable categories, and then you need to try and harmonize that with individual countries. And clearly you can't do it for the entire globe, so you need to build on that system on a regional basis. So the work we're doing in Africa is to build it according to sub-region. So Southern Africa needs to develop a common system, say associated with the Southern African Development Community, which has 15 countries, and so on and so forth. So that's the first thing. The second is we must be able to have an agreement on what we share, and in respect of the issues related to the constitutional rights people have to privacy on the one hand, and therefore to deal with proprietary information. And you know that is a controversial issue that has to be negotiated. We suggest negotiate it on a regional basis. Trying to do it on a global basis is very difficult. So that's what I would say. But it's really important. You can't fight a pandemic if you have different systems and you're measuring different things. You just can't do it. The fact is the globe is made up of countries, and countries are the actors, and therefore we need to work with individual countries along the way.
Right. How do you, obviously we're focused on COVID and the frameworks that are coming out of COVID, but how do you create, or how do you think about setting up a system that isn't biased to the system that precipitated it being set up? So when you think about future threats, future pathogens, how do you think about that, taking what you're learning and applying it more broadly?
I would probably say the one thing that comes to mind is we can't do it alone. I think any kind of system that is created has to be a fantastic collaboration and partnership between multiple stakeholders across multiple different areas. That would be probably the most important thing. If we really want to have a true data sharing entity that shares both sides, of course, shares within the federal government back and forth, but then also shares outside. The most important thing is stakeholders and partnership.
Go ahead.
Yeah, so I mean, I just think that imagine in 2020 if we had a global network that was set up for early detection, what a different place we could have been in. And I think we need to think about that. And we need a supranational body, really, to coordinate. There are a lot of global efforts now, but some of the data sharing, I think, needs to be coordinated. So there's a lot of effort right now in Europe to set up a global wastewater consortium that harmonizes methods and has data that's interoperable and that also shares that data. And I hope that that grows and comes to fruition, but we definitely need global cooperation and supranational leadership because really it's in all our best interests because the early detection piece and whatever mitigation and public health actions come from that for whatever pathogen really can help avoid the costly border closures. They can help avoid travel and trade disruptions, which is in everybody's best interest, not just a public health perspective, but really a global perspective.
Yeah. Oh, go ahead.
I was just going to say that, I mean, to get very practical about the issue, in low-resource countries in the developing world, I think we should invest our efforts and our money in upscaling early warning systems. And early warning systems is best advanced if you get early detection right. So with early detection, you know what the pathogen looks like, you know what it is you're looking for, and we have the technology and the systems and the people to, in fact, make early warning system work properly. So I would say that's where the effort is. If you look at event-based surveillance, and you're talking about genomic surveillance, that becomes expensive when it comes to looking at developing early warning systems as opposed to early detection systems. That's great, that comes later, but focus on making early detection systems operate, and there are norms for that. We are saying you should be able to detect something in 7 days, and if you're not, put systems in place to make that possible, report it then in 1 day, and then respond within 7 days, because warning is useless if you can't respond when you're done with the systems.
So we were talking about this before, but early detection systems, like how much of it needs to be new tech? Like what's the role of existing technology and what can be done with what you have in terms of where you've put those efforts?
Well, what you require would be diagnostic capabilities that can be easily mobilized depending on the pathogen you're looking for, and its variants. And therefore, you can imagine how AI, for example, can help with that process and accelerate it. So diagnostic technologies for fast detection and characterization. And you require innovations in that space, and you already see it happening.
Go ahead.
Yep. I would add to that, I totally agree that we shouldn't leave lower and middle income countries behind. And wastewater surveillance is a valuable tool, but we just need to be cognizant of using the right tech for the right public health need. And there are some really good use cases for airplane wastewater surveillance, community wastewater surveillance, and all these innovations that have come out of the pandemic. But we should never be doing it just to do it because it's a shiny new object. We really need to know that it has public health value. And I think Mpox has been another example where this technology has been valuable. There are others like dengue and other concerning threats where this technology can be used. And we're starting to, the traveler genomic system has been used looking at other pathogens besides SARS-CoV-2. And I know you asked that before, but we were looking at flu and RSV and other pathogens in both airplane wastewater as a proxy for early detection and from the travelers themselves.
Is there an element of infrastructure that you're not working in that you think would be interesting? Sewer water, airports, is there somewhere?
Well, I think it depends on the individual use case, and if there's a need, I think that's where the innovation and the private partnerships, and I was saying this earlier, that earlier in my career, I just never would think that I'd need to work with air ground handlers or airline executives or sewer workers or wastewater treatment plant workers. But it really shows you that pandemic preparedness is a whole society approach. For successful pandemic preparedness, we really have to integrate the community into our approach.
Oh, go ahead.
I'll
You wanna
add a little bit on the impacts component. Before I joined this wonderful team, I helped lead the impacts response at the White House. I vividly remember when we sent that email to CDC, and the email was just to ask to see if it would be useful to have wastewater surveillance. Remember, we didn't know a ton about wastewater surveillance before COVID. So we just floated that thought over just to see if we could actually use it, in this case, data for action. CDC was more than willing and jumped on it. We did wastewater surveillance. I will tell you that wastewater surveillance ended up being not only data for action, we identified clusters before they happened because of the wastewater, and we were able to have public health interventions immediately on the ground. It was incredible.
Journalists love to talk about AI, so I will ask, how do AI, gene editing, and other sort of emerging technologies change the calculus in terms of when you think about the threat and the response from your perspectives?
The benefits of AI applications when it comes to biotechnology are extraordinary. And we can speak about the potential for how it would improve clinical medicine, how it would improve public health, and how it would improve biotechnology innovation. And the benefits are, I think, are extraordinary. But the risks are also great. We don't understand a lot of the risks, but you can imagine how AI can power the production of pathogens that are enhancing their transmissibility and enhancing their pathogenicity as well. So it's really important for us to develop biosecurity systems as we go along the way. So for me, I would imagine, not being a scientific expert in the area of artificial intelligence, to say that the potential for risks, for benefits, are extraordinary. And I won't put a number on it, but it's certainly more than 50%. And I would imagine if you're sitting with 90% benefit and 10% risk, that's a good balance to have. And what we need to make sure is that we have systems in place, guardrails in place to look after the risks.
We have just like a minute left, so I'm wondering if either of you want to add to that from your perspective.
No, I would just say that I think that AI, if we have limited resources to set up a global network and get airplane wastewater and know where the pathogen or the risk is coming from, we can utilize, with the data that we have, we can utilize AI, machine learning, to really put the data together into models and predict where an outbreak is occurring. Because it's hard to get all of the nodes set up, and so I think AI could be a tool that would be beneficial. Nikki?
When I think of AI, not only do I think of what it can do in pathogen detection, but also medical countermeasures. I think the options are endless. And my personal passion, which is diagnostics, I think AI is probably a resource that will take us further in our preparedness efforts than anything else has before. I'm excited. But as Wilmot said, it's really important to have guardrails to protect against bad actors.
Thank you all so much. I really appreciate it. It was great to hear from you about very, very different things. So thank you. Thanks for being here.
Thank you. Thanks.